Good afternoon, everyone. Thank you so much for joining us for this webinar. So we're going to be talking about digital health ethics, and particularly from a charities perspective. So I'm Lotte Coppieters, and I'm the digital project manager at the Association of Medical Research Charities. And we undertook this piece of work in collaboration with DataKind UK. So I've got Tracey from DataKind joining us as well. So she'll be doing the middle section of the presentation. So without further ado, I'll make a start. So just to introduce AMRC to anyone that isn't aware and isn't a member of ours. So we're a national membership organisation for medical research charities, and we're quite large in number, so there's 146 members, and our membership is really entering into the digital health space as well, with £380 million in healthcare technology invested a few years ago. And there are a number of ways that our members are really engaging in digital health, and I've listed a few examples. This is very much just a selection, and if there are any members listening that are doing work in this area, I'm always interested to hear about examples, so do get in touch. But examples include endorsing digital health solutions or even developing them themselves in collaboration with tech partners. There's also patient data, and both collecting patient data as part of registries and then using that patient data to develop data-driven technologies. There's also providing digital services direct to patients and beneficiaries. So that's just giving a sense of our membership's work in this space. So some background then on the ethics space around medical research. So it's very much something that's ingrained within traditional medical research, so the kind of biopharma side of things. And it's really part of a lot of the processes that happen and is accepted as quite a day-to-day thing, whereas digital health is moving at such a fast pace that ethics, while often talked about and very much at the forefront of a lot of conversations, the kind of processes behind that aren't as put in place. So we're really playing catch up a bit, and what taking due consideration of ethics will really allow us to do is to bolster the work in this area and to make sure that efforts that are done, and there is a huge amount of efforts happening within digital health, really have the maximum benefit. So digital has huge power. I think that's generally what most of the health community feel like. It's just making sure that we harness that power, and definitely a huge part of that is tempering it with an ethical responsibility. And there is clearly an awareness of this because there are a huge number of ethical frameworks in the space, and we found when we started to look at this area that none were really specifically tailored to medical research charities looking to enter into digital health. And we really felt there was a need to clarify which principles are most important and relevant to charities in this space. And we really reached out to DataKind to help us develop a tool to enable our members to apply some ethical principles to their work. So at that point, I'm going to hand over to Tracey, who's going to talk a lot more about the actual process of developing the framework.
Great, thank you. So what I'll do is just give a little short introduction to DataKind UK, talk a lot about our process, so how did we get to these 9 principles for AMRC, and then so we've developed principles, so what? Really it's about applying these ethical principles, so how can charities apply this internally, and also how can they convey their ethical stance when they're working with tech partners, so how do we apply this externally as well. So DataKind UK, we are a community of volunteer data scientists. We're approximately around 1,600 data scientists in the UK, and we're also across the world. We're in the US. The idea generally originated from the US, but by a data scientist who said, why are all these data science skills being used to get us to buy more stuff? Why can't we use data science to actually help resolve and support charities and really resolve social issues? So in the UK, we really focus on sort of 4 main areas. The first one being around data therapy, which is providing light touch support to social change organisations. So I mean charities, local government, and any data question that they have. It might be data strategy or really in-depth looking at coding. We have a team of volunteer data scientists that can help with that. We also run a peer support group for data scientists that work in charities that meet every 6 weeks, and they talk and share about the data issues that they're working. Often enough, being a data scientist within a charity can be quite lonely, so they actually appreciate having this space to learn from each other and to do some training. Our main kind of bread and butter is data dives, and this is where we work with social change organisations to help them to provide insight into an issue that they're working with. So we recently worked with Anthony Nolan Trust, who came to us with a problem of wanting to understand the attrition rate of people that sign up to be stem cell donors, but then actually when they have a match, don't actually attend. So we worked with them, helping them to clean their data, define the problem, and then over 6 weeks we did that, and then over 2 days we just opened it up to our volunteer data scientists to actually do some analysis. And of course, we can't do that. There's only a certain amount of analysis we can do over weekends. So the next program we provide is what's called Data Core, and that's when we have a team of volunteer data scientists that will work with social change organisations to actually build a digital or data product. And finally, our final program is about data responsibility, which really runs through all the work that we do. And in here, we really want to support social change organisations to develop and implement responsible data products and services. And this really follows our own internal work, where we wanted to ensure that the volunteers that we worked with also had this ethical stance, and were able to convey this to the charities that we often partnered with. And then from that, I believe AMRC saw the work that we did in conveying our ethical principles to our community, wanted to bring us in to help them in sharing how to also convey ethical principles within the community of medical research charities. So enough about me. The process, how did we get to these 9 principles for AMRC? And I would say we definitely didn't start off saying that we're going to create yet another set of ethical principles. My partner in crime, Christine, who worked on this project, came up with the term YAPE whenever we saw these ethical principles coming up, so which is yet another ethical principle, YAPE. It was very much just to really kind of synthesize these number of principles that are out there. And so for AMRC, the key thing for us was understanding the environment of which AMRC members are working in. And so there's, as Lotte has mentioned, there's increasing recognition of the need for charities to understand and make use of the latest data, digital technology, products and services to really enhance the services they provide for the diagnosis, prevention, treatment and outcomes for the medical conditions or health conditions they work on, and for their own operational effectiveness. And there's many different areas in which charities are beginning to apply data, digital technology, as Lotte's mentioned. So currently, charities, as with private and public sector organisations, are really exploring the best ways of developing and making use of these technologies. And so being experts in medical and health fields, we're often entering into partnerships to marry this expertise with expertise of the digital data industry. So traditionally, I'd say, and do correct me if I'm wrong, anyone that's listening, charities partnered with academic departments which have long established ethics committees. They would often review applications. But within this new state where there's many more private sector organisations interested in partnering with charities, there's a new emphasis on ethics, especially because, unlike academia, the traditions of ethical reviews haven't been quite as embedded within the private sector as such. And so there's more onus for charities to become more engaged in ensuring that their values, and in particular their ethical positions, are conveyed. So, developing an ethical framework. So ethics is a concept rooted within the field of philosophy. And at its simplest, it can be described as a set of moral principles or ways in which we determine what's right from wrong. And in the past year, we've really noticed there's been an explosion of principles, codes of conduct, checklists, tools, and more around AI and data ethics. And whilst this can be interpreted as a welcome sign that the tech industry is beginning to take the ethical development and use of data and digital tech products seriously, it also means that this avalanche of ethics makes it difficult for time-pressed charities to know which ones are relevant. So AMRC, when they approached us, believed that one important, and we could even say ethical consideration for providing guidance to their members was not to simply add to this list of principles, but to really assess what was out there already. So we undertook a review of over 60 ethical codes, checklists, however you want to name them, across a number of different fields. We looked at social sciences, health, engineering, computer science, statistics, finance, could go on, from a range of different writers and authors, academia, government, charities, private sector. And then we went back to the actual context for which AMRC members were working in, and some of the concerns and issues that they had raised when we did our initial interviews with a number of AMRC members. And so we thought, thinking back to the context, we considered a useful framing for picking out all the various frameworks and principles that would be most suitable for AMRC members would be to focus on these 4 key areas. So the first one being biomedics. As AMRC members fund health and medical research, and these areas have a long tradition of bioethics. And bioethics is the ethics of medical and biological research. Next, data digital tech industry, which we're saying is covering mainly the private sector, but academic as well, and the government doing work in this. Ethical principles that are arising from the tech industry are going to be relevant as AMRC members are seeking partnership with these tech firms. Thirdly, the charity sector. Generally, charities are held to higher ethical standards than corporations, so it's really important that we were checking principles that have been produced from the charity sector and considering how these principles are appropriate for the sector. And finally, public health. And the public health field has a rich history of ethical research, particularly because it acknowledges that there often is tension between individuals and the groups. For example, quarantine of infectious diseases might limit someone's individual freedom, but it does so for the good of the public. And as big data comes into play more and more in digital health, the chances of impacts beyond the individual patient becomes greater. So having reviewed the literature and speaking with charity and experts working in the fields of ethics, at the time of writing this paper, we found that there was an absence of a perfect set of principles that fitted the definition and areas of concern that had been raised. I should highlight there are many commendable frameworks, especially like the Academy of Medical Sciences, our data-driven future in healthcare, what's come out of Department of Health Social Care and the Conduct for Data-Driven Health and Care Technology, DCMS Ethics Framework, AI for People, but here we get into the problem where actually I'm starting to recommend a lot of frameworks and principles. And so what the key thing we needed to do was almost synthesize in a way and really pick out what is going to be relevant for the charities that we're working with. So 67 resources later, this is just a snapshot of some of the principles that were reviewed. You can see all the 67 principles within an appendix, which is hosted on the AMRC website. So I'm now going to delve into the actual principles themselves, discussed in that framework of those 4 areas of biomedics, tech industry, charity, and public health. So first, biomedics, and the field of biomedical research, as I have mentioned, has an established set of ethical principles, commonly known as the Georgetown mantra, and these have played a really important role in contemporary development of bioethics, and more recently we were able to see that this is applied a lot in some of the digital and AI ethics frameworks that we had reviewed. So it sets out 4 key principles to assess good ethical practice. First being beneficence, so generally do good, do work that is beneficial, that's going to benefit individuals and society. Non-maleficence, which is avoid taking harm as much as you can. autonomy, which is about preserving human agency. But that also implies that there's sufficient knowledge and understanding to decide. It's an important part of angle of this is informed consent. It also includes deciding not to decide. So very much in the future, we might just give our decision-making powers to AI or robots, who knows? But it would be our choice to do that. And then finally, justice. So be fair. And a lot of, when we were discussing these principles, especially in the AI world, there's a lot of discussion about algorithmic unfairness or bias that's taking place. And we think that really would be covered within this ethical principle of being fair, ensuring that you're treating people equally. So for every main frame that I present, main area, I'll also try to give a bit of case study or an example from what we have read. And so this comes from a paper written by Martin Dunn and Roberts, where basically it's a nice short paper where they give an example to illustrate, to really show, well, they're discussing the ethics of using a machine learning model to predict patient outcomes in psychotic episodes. And so the paper actually discusses some of the arguments and thoughts that they've had about whether they should actually use this model to actually treat patients. So I'd encourage everyone to read that. And generally, the paper highlights that because of the severity of the illness, that the lack of other options for improving recovery rates and the potential for a more accurate prognosis, that actually using this model would be beneficial, and that the risks were acceptable and they were relative to the, and were fairly relative. Very interested to hear more cases of applications or where people actually actively discuss how they come to their stance. Would love to see more of that. The next area is about digital data tech and industry. So in the middle of reviewing our 60+ ethical frameworks, a very helpful study from AI for People. This is a group with Floridi and a number of academics across the EU, came out and basically it was a review of the core opportunities and risks that AI brings to society. So we're like, great, this looks like somebody's done our work for us. In brief, they had synthesized 6 ethical frameworks and found that the same 4 bioethics principles highlighted earlier in this webinar were commonly incorporated, but argued that there should be an additional principle, and that's about explicability, which covers a really broad area as such, but it would include things about being transparent, ensuring that you're able to explain about what the model, where the data comes from, how the model works, that the model is auditable. Expects that the model, assumptions and input data should be transparent, and also that it should be clear that reasons for decisions should be obtainable and challengeable by people that this affects. So an example of I can't pronounce this word now, explicability, was basically a paper written by Zek, where they had trained a convolutional neural network, which is a type of image classification algorithm aimed at diagnosing an enlarged heart from chest x-rays. And what you can see if you're viewing this webinar is 2 pictures of x-rays of people that are suspected to have that is an enlarged heart condition. And the key finding they found was that they trained this model to really pick up and identify what was taking place within the scan. So scan the heart and see whether it's enlarged issue. But what you saw on the right and which is highlighted was that some high scores were being predicted outside of the heart region. Which is interesting. Why is a scan, or we're focusing about the heart, picking up information quite high and quite significant outside the body? And what they noticed was that the actual machines that were used on the left-hand side, one is a portable machine, and a portable machine is usually used for patients that are that have been scanned when they've been bedbound. And the other scan on the right It was one that was scanned by someone that would have walked to the department. And so what was happening here is that it's actually, this model on the right is down weighting this person's likelihood of having an enlarged heart condition because they don't have that word portable in the top right hand section. So this model is actually picking up additional information outside of what's actually taking place in this person's body. So being able to explain what's happening, not just quite sort of straight away working with this model, is really important to see, is the data that's being used actually the one that should be. Another example, which is mainly about human transparency. This is a report from ProPublica, and it discusses about, and the case studies from the US, that certain patients that had a condition of sleep apnea, they would use certain machines to help them breathe at night, found out that the data that was being collected from the machines was also not just being sent to the company that produced the machine, but was being sent to their health insurance. So you have this case highlighted in this box here of Mr. Umansky, who was prescribed a new mask and airflow setting for his machine. But when his mask didn't arrive, he called the tech company and found that his insurance may not cover the cost of his mask because he hadn't been using the machine enough. But the problem is he hadn't been using the machine enough because he needed his new mask to actually use the machine properly. So we have this issue where actually something has been withheld, prescribed, needed equipment, his mask, because he wasn't using the machine as he was prescribed to. So it's important that people are aware and know what is happening to their data, where it's being sent. That's not a nice feeling. So when he calls them up, he says, "Wait, you guys are using this thing to track my sleep?" That's quite disconcerting. So next, charity and non-profit sector. So increasingly non-profit organisations, particularly in the international development sector, are developing ethical principles for working with tech companies. In the UK, our National Council of Voluntary Organisations have recently launched some ethical principles which are more general, so they're not focused as much on data. And so we found two papers that were really of use came from the MEL tech sector, which is MEL standing for Monitoring, Evaluation, Research and Learning. And also a paper written by 7 medical research charities, chief execs, and the AMRC called Promoting More Effective Partnerships. And in essence, for the MEL Tech paper, there was 9 digital principles that were outlined, 5 of which mapped quite nicely onto the principles we've just explained, but 4 of them we could kind of summarize as covering areas of sustainability, which was really also highlighted by the AMRC and Chief Exec's paper, which is about ensuring that thinking ahead about these products that are being developed, how sustainable that they can be, and actually to act ethically, you'd want to make sure that we're not just kind of creating lots of new apps that kind of go away and are not being sustained, especially if they provide some benefit to the people that we work with. So an example for that of this not being applied, with one of the principles that I didn't mention was about the community mindedness part, especially because within the charity sector and the fact that many people have multi-mobilities as well, there is a much more inclination for charities to work together, not so much in the private sector. And here we have an example of the winner takes it all mentality, that in 2018 Samsung removed all the compatibility features from its health app, blocking any third parties from being able to deliver services alongside it. And whilst in the private sector, it can be accepted that organisations seek to be market leaders, and it produces an environment that often disincentivises collaboration, whereas in the health sector, such exclusionary practices should not be an acceptable norm, given the need to prioritise maximum benefit to patients. And so interoperability, where we can, should be standard, and particularly given the increasing need to tackle multi-mobilities. Finally, our last look was at public health. which is primarily concerned with the health and well-being of society, balancing respect for individual choice with wider societal benefits. And often enough, it can mean that individual autonomy can be overridden for the greater good. So this also really was interesting because it highlighted that some of the principles that we have looked at can be in tension at times, depending on the context of which they are applied. But a key principle that we saw that hadn't been covered elsewhere within public health was about the issue of being proportionate. And that's being sort of proportionate to the relevant risk that's taking place. So a particular paper from the Department of Health, response to pandemic flu, was on the issue of proportionality, was that decisions on actions that may affect people's daily lives, which are taken to protect the public from health, will be proportionate to the risk and to the benefits that can be gained. So an example perhaps of where proportionality or disproportionality as such comes from Royal Free London NHS Foundation, which is a well-known case sharing sort of data on 1.6 million patients with Google DeepMind. And it was found to be a breach of the Data Protection Act, so not just an ethical breach, but a legal breach as well, where the Information Commissioner wasn't persuaded that it was necessary and proportionate to disclose so many patient records. So this means that we came to 9 principles, and I have explained our process, but actually it wasn't a linear process. It wasn't sort of quite as additive as that. It was very much like spaghetti, trying to kind of get everything straight and ordered, and then really think about frameworks. We initially considered that there were 8 ethical principles that really came, that we really quite reasonably convinced about, but of course we had to test this, and we put this to a workshop that we held with AMRC, and really discussed these 8 principles. They turned into 9, and we had some other principles that we threw to the room as well. One of the biggest discussions we had was around the principle of being evidence-based, and we went back and forth in the room about that. This principle came up within the Academy of Medical Sciences paper, but in the end we decided not to keep it in because being evidence-based should actually run through all of the ethical principles. So how will you know that you're providing, you're avoiding harm or providing a benefit if you're not thinking about evaluation and looking at effectiveness? So the process, as Mohammed mentioned, interviews with charity experts from a number of charities here. Really thank them for their time and being open about the work that they're doing and what they felt was needed from this project. We did interviews with experts working in the field from Ada Lovelace Institute and Alan Turing, Royal Statistical Society, Wellcome Trust. We, as discussed, have done this review of over 60 principles, and we held this roundtable discussion as well to really test our findings. So, how do we apply this? As set out right from the beginning, we didn't want to create another set of principles. And so what we have done is said, here are some of the core principles that we think are going to be useful and highly relevant to AMRC members. But you really do need to take these principles within your own organisations and discuss them, take them apart, bring them back together again. But do this by with your beneficiaries, your staff, volunteers and trustees. What fits the values of your organisation? And also as well, it's not a one-off exercise. It's not something that you'd only do at the beginning when you're using or developing a DDT, digital data tech product or service. You can use this at any time, at any stage. And certainly once you've got one set of principles, it's about reviewing the context of what you're developing, because you might find that some of the principles are more or less relevant or important depending on what you're working on. Creating, if you're, say you're happy and everyone says, yay, great, ethical principles, You do need to create some lines of accountability to encourage that it's used. Otherwise, you have these principles and they'll just be dormant. So think of ways in which you can include this in your everyday business, everyday way of working. So perhaps within documentation, within your startup or starting up phase, or midpoint reviews toward the end, and certainly when you're evaluating and looking at the impact of what's been produced. I've said this many times, context is key. So when you're creating new products and services, applying them in different areas, definitely do review your ethical principles. And also give a warning as well that this is a subjective process. Really thinking about what's good and bad isn't as so black and white, and certainly the way that has been developed would certainly have been framed by the perspectives of myself and my colleague, and the interviews and the people that we've spoken with as well. And bearing that in mind, what we've tried to do is reflect the best practice and norms and standards of today. But the rate and pace of technology, and as it shifts, also means that the norms might shift as well. So this has to be taken as a live document. That's something that you will constantly be reflecting and looking at what's the best practice within the charity sector and the tech sector as well. Okay, so that's applying it internally. What about applying it with your partners? So as I mentioned, you've got these principles and you've got buy-in within your organisation. So what? You don't want this to kind of disappear when you go into tech partnerships. Many of the charities that we've spoken to are, come into these relationships knowing that the tech industry, they have lots of expertise, but also the charities as well, is to recognise that you are experts within your field, and actually you come with a lot of power. When you're having these conversations, and often enough you have the data which tech industry are really interested and keen to get their hands on, or the access to beneficiaries and people which can test it on. So you also have some power within what you're doing to enter these partnerships. So what we did with this project and within the roundtable is we discussed how the best ways that you will kind of convey your ethical stances, depending on which principles you choose. We decided the best way is to create a list of questions that charities can look through and check and see which ones are going to be relevant to kind of take through with them when they're entering these conversations with tech partners. So we had a case study. I won't read it out, these slides will be available later, but basically to create these questions, we really wanted to kind of root it in a kind of a practical example. We also supplemented the questions that we developed from our roundtable with additional research, so more reading. Basically, we looked at sort of 10 papers, really useful ones from sort of machine intelligence garage ethics, which my colleague Christine sits on their steering group. The Open Data Institute have a great data ethics canvas. There was lots of sort of high-level expert group work done on artificial intelligence, which was a draft format when we reviewed this work, but now it's finalised. So there's a number of these principles that actually provide some questions, and we synthesised that as well. So ideas for applying this really is for charities to kind of select the key principles for the project. For each principle, we have a whole list, perhaps 10 questions that you can choose, but over all of your principles, you wouldn't want to go in with too many questions to a tech partner. You don't want to frighten them off. But it's important that you choose which ones are relevant. Also consider that the amount of time that there will be other important sort of ethical stances as well, but not quite rooted on ethical principles that you would need to speak with your partners. So the contract that's going to be written up, and who owns IP are some of the core issues that we found. Discuss the answers that technical partners provide to your questions with charity stakeholders, especially beneficiaries. Are these acceptable? Do you want to go into partnership with this? And also, discuss any ethical concerns with your partners, or if needed, ask others to provide some advice as well. And do make sure you record these ethical concerns and the issues and what decisions you made and you and your partners made around this, so that later on you can reflect and kind of learn about whether any of the issues that you had identified, you're looking to kind of mitigate these as much as possible. So as a cheat sheet at the end of the questions paper, we do kind of provide a list around sort of 10 questions that you can use if you wanted to do a quick triage of just flagging out whether this partnership could potentially be a goer. But due to time, and I've spoken way too much, I will stop there. And here's a final kind of picture. There's a lot of shaking going on. When I spoke to ethics with a couple of charities that I've been working with, they were like, oh God, ethics, we've only just got over GDPR. So I really hope that you're not shaking and worrying in fear at all. But if you are, come and have a talk. But this is really about, you know, the values of your organisations, how you work with them and how you convey them into the digital work that you're out taking forward.
Great, thank you so much, Tracey. I'm sure I'm not alone in thinking that it's just astounding and amazing that they managed to look through 67 various principles and codes and have managed to distill it in something that's so understandable. So that was a great summary, and I particularly love the case studies. So before I just dive into the last little section, I wanted to raise that we are going to be doing questions after I've finished speaking. So if you did want to submit any questions in the toolbar that GoToWebinar has on the screen, you can type in the questions and they'll ping straight through to us, and we'll be running through some of them in a bit. So what I wanted to just touch on was that alongside this piece that DataKind did with us, and particularly this ethics piece, we also did launch another resource recently that was also focused on partnering with tech companies to develop digital health solutions. So obviously Tracey was just talking about the questions that you can ask of partners, which is a really useful resource, and we also wanted to develop something that could offer a high-level guide as to how you might approach developing a digital health solution. So not really focusing on the ethics, but just more the process, how to approach it, and what kind of stages you might see, and what kind of things you might want to discuss in the contract or with your partner up front. And there are also some great case studies from our members that have already started working with tech companies developing really great services and products. So I just wanted to signpost to that in case people were interested in understanding more about the partnership process, and you can just see the link on the screen there to find that. So we are moving on to questions now. So we've had a couple in. Do keep sending them in, as the beauty of digital is that we can see them live. So most of these probably Tracey will answer, but it might be a bit of a joint effort. We'll see. So the first one we have is, what kind of project would this apply to? Do you expect it would be applied to individual projects specifically, or do you expect charities would develop an organization-wide framework?
Yeah, great. Thank you for that question. So yes, I would expect that charities would develop an organization-wide framework. I guess in essence, really, what we have done is we've provided a sort of an organisational-wide framework, and that's for each charity to kind of look at and see, does this apply? Are there actually other principles that we consider which really reflects our values and our principles, and to include that in. But also as well, it's this point that we've raised is to highlight that when you're doing these individual projects, you really need to consider what context that you're working in. So for example, the fact that you might be using data already that you already have, or you're creating a digital application which collects data, would also mean that the principles that you would use and assess to see which one of these you should be working on or going ahead will change. So the context of the work that you're doing really matters, which is why if you do have a sort of an organisational menu board, you then within an individual project will pick which one of the menu you'd like to eat.
Great. And then we have another question, which is, how do the principles and checklists reflect DataKind UK's practical or hands-on support that you provide to charities? That's definitely a Tracey question, I think.
So I'd say we are learning just as much as anybody else with the whole sort of sets of ethical principles and codes and conducts. But what we're really striving to do is ensure that we're embedding this whatever work that we're doing. And so I mentioned when we're doing sort of office hours and providing support, we're also thinking with our volunteers, are there any ethical issues that might actually come into hand? When we're doing data dives and we're helping charities to clean the data, we're thinking, well, where does this data come from? What are the potential biases that could be had from this? So actually, for us, principles and checklists, and that's why we kind of say, so what, has to be practical and has to be embedded, and it has to be a way of working rather than an additional extra. And we found in the past when we've said, oh, just look at the principles and be fine, it doesn't really happen that way. It needs to be embedded. So I'd say in answering to that question is really that it's just part of what we do now.
Great. And then we also have a question. So if we've never worked in this area before, what would you say is the main thing to take into account?
I would say the main thing to take into account is the awareness of, I'm going to say the word context again, about the environment that you're working in. If you're completely new, I would recommend you read our paper. That's such a, but I think it would be really useful as kind of summarising what's happening in your field, and talking to charities that are working in similar areas to you, finding out what they're doing. So I'd say that's the main thing, is kind of talking and reading. It's a fast-moving environment that's taking place. A little while ago, there were very few people talking about the ethical principles and stances that should be taken in technology. It was very much a small group. And then when things started to go a little bit awry, especially with some case studies in criminal justice, where actually by the models that are being produced was actually increasing social inequality. That's when we've seen this kind of explosion and a kind of catch up and race to kind of to see what's taking place there. So it's really about just watching what's happening in that environment, and not being afraid as well. You might not get it right first time. We're not sure we're getting it right. We believe we are, we try to be. So if anyone sees that we've done anything wrong, do let us know. We're still learning about this, which I'd say the tech industry don't have a handle on this at the moment. You can't say that they've sorted it out, nor is government, nor is academia. Everyone is kind of working and really thinking, what is the implications of AI? We don't know. So we do think that charities, especially with the knowledge that they have, the people that they work with, their beneficiaries, should have a say in what's taking place.
Yeah, definitely. I think just to build on that, from AMRC's, or at least my point of view, kind of thinking about our members putting this into place, I think often when the word ethics is raised, there is a lot of fear. I think Tracey's little gif at the end demonstrated that very well. But I think there really is. And we really noticed this actually when we did the workshop with DataKind around the ethics framework, was there really is no right answer. It is very subjective. It's so down to interpretation, you know, even just taking the example of beneficence, the first principle, you know, it can be beneficial to one person, but potentially not to the majority, and vice versa. So there's a huge amount of nuance, and it's, I think, yeah, what Tracey said really is don't be too afraid, because everyone's kind of afraid, but you just need to go for it rather than ignore it. And I think just talking to as many people as you can is hugely important. You know, charities particularly talking to beneficiaries, but also to tech companies, to people like DataKind that do a huge amount in this area. I think that's the only way you can find the best answer for the time being, is getting as much input as you can, really.
Completely agree with that.
So just another question then. So we kind of touched on this slightly, but when ethics is such a major part of the usual research process, why are they just being introduced for digital development?
Ooh, that's a very interesting question. I think so. This is my opinion. I would say that why are they just being introduced now? It's because the pace and scale of digital technology, the fact that it hasn't been that long ago that we didn't really walk around with Android mobile phones and having information right in our hands, and now we have that today. And it's been exciting and hugely transformational, and we can see that there's just been more and more interest of, if we can do this, we can do that. What about doing anything? It's really open, and sometimes that case of, well, just because you can do it, should you do it, hasn't really been thought through as such. And so I'd say it's only because of these, well, partly because of the fact that within the field of sort of ethics and there's technology studies, academics have been increasingly raising the issues about this kind of fast-paced world, and not taking enough time for reflection about the actual implications and consequences of what's taking place. And with sort of really high-profile cases, as mentioned, like in criminal justice, or even actually in terms of social media and the implications for democracy, if we really want to go that far, it just has meant that there hasn't been that much time for reflection as what's needed. And so now technology companies are recognizing that you can't be as quick and fast-paced when you're applying technology to the social sector. The implications of getting people to buy more shoes are going to be vastly different than creating models that's going to predict whether someone should receive a service or not. So it's very different, and I think that's why you need much more within the social and health sector, much more collaboration between tech companies and with subject experts that can really explain and consider and think through some of the consequences and how it might actually impact on people.
Great, and I think we'll probably move on to just the last couple of questions now before wrapping up. So one question that's come in is, do you have any examples of members who have used this framework? So this is probably slightly more a question for me, I suppose. And the answer is, we definitely have some members that have found it really helpful and are starting to look at this, but I think it's really building on some of the application piece that Tracey touched on. Is we only launched this at the end of March, so not that long ago, and there is no easy answer for ethics, and doing that whole process of getting organisational buy-in and really hammering down onto what exactly you want your ethics to look like for particular projects isn't a quick fix. Despite the framework, we hope obviously giving people a great foundation to build upon, there aren't any members that have actually kind of fully implemented it, and we're seeing the outcome of. But there are definitely members that are starting to look at it, and indeed we are really interested to hear from anyone really that's applying the framework and that is finding it useful, and how you're actually kind of putting it into practice, because it's definitely a piece that we see as very iterative and a live document. So we hope to kind of build upon it and improve it as much as we can to make it as useful a tool as possible, really. Do you want to add anything on that one, Tracey? Probably not.
No, I was going to say I agree completely. I would love to hear more examples from charities of applying this, and also sharing that more widely as well, and let others know about this. So if I can, I just want to really commend AMRC for doing this piece of work. There's very few kind of charities really entering the space and kind of really more publicly saying this. So I think there's a lot to learn from this work. So do let us know, do feedback, and especially for DataKind, this is the first time that we've actually tried to kind of transfer what we did with our own community to another community, and we're working with the GLA at the moment to see how we can support refugee charities and how they think about ethics and the data that they're working on. So ways in which we can improve, do let us know.
Great, and then wrapping up with a final question then, how widely did you consult to find out what was needed? I think that's definitely probably a Tracey question.
Right. I felt that we spread the net really wide. So as mentioned in the slides, We spoke with experts within the ethics field. We had sort of in-depth interviews with AMRC members. We did a lot of reading, many frameworks, and it was very enjoyable because we're geeky like that. If I can say the limitations, not just to boast, we aren't ethicists. There are people that really spend their full time thinking about philosophy and the ethical implications of that work. We're just much sort of sympathizers and have our own opinions about this and working in this space. So perhaps there is more work to be done with reaching out with that. And also, we didn't speak with beneficiaries or service users directly. We're actually using the knowledge of the charities, which is why we say that to actually really apply this, you need to get them involved. If the consequences of it is not going to harm me, it's going to harm actually the people that we're working with, so their voice is really crucial and important. So I'd say that the net does need to be spread wider.
I'm going to sneak in another selfish mini question for me. So you mentioned obviously ethicists kind of that spend their whole days and hours and kind of thinking on this, and I think I'm right in saying that you did speak to quite a lot of ethical experts during this process, and I guess I'm intrigued, and maybe other people are intrigued, how helpful did you find it speaking to people that were actually really kind of in depth in the ethics space, or do you think people might almost find it a bit daunting and quite confusing, because I suppose it can be quite philosophical and a bit removed from real world applications? So I guess I'm intrigued what you found more useful, I suppose, which is maybe that's a bit harsh to make to make some conversations be said to be less useful, but I guess I'm just intrigued, do you think as a society, as anyone that's doing work in any space that should be ethically considerate, do you think people should be speaking to ethical experts, or is that actually going to confuse the situation more?
No, I think on both sides, I say that these ethical experts could do more to reach out to charities and to people as well. I understand the Ada Lovelace Institute want to do more of that in terms of the societal implications, but I haven't seen as much from the others, which are very much, and perhaps rightly so at the moment, or maybe not rightly so, but are focused on the tech industry, who are on this kind of runaway train to kind of bring it back in again. But there's definitely some of the papers that we read and where it's being placed, they're not being placed in the kind of charity sector and charity media. And I think charities have so much to bring into these debates, which are just not being utilised at the moment. So I'll end with a neutral thing of I would like to see more conversations taking place between these two partners.
Great, thank you so much. So on that note, I'll just finally finish with our contact details. So if you have any questions or comments, like we said, particularly on the framework or using it, or questions from the webinar, just get in contact with us. We're really interested to hear from you. And yeah, we hope you found the webinar useful. And I think that's it. So have a lovely rest of the day, and thanks for joining us.